As dentists who work in a demanding clinical environment, you have extensive control over procedures, equipment, sterilization, and clinical judgment. But there is one factor that determines patient trust, satisfaction, and risk exposure more than almost anything else, and that is communication. You can provide clinically correct treatment and still end up facing complaints or misunderstandings simply because a conversation didn't happen or wasn't clear. Every patient interprets words differently. Every assistant hears instructions differently. And every interaction you have carries the potential for a misalignment if communication isn't intentional. So, how exactly does communication influence risk, patient perception, and malpractice exposure? Well, that's exactly what we're breaking down in today's video. So, if you truly want to understand how strong communication can protect your reputation and reduce your liability, stick around and find out. Hi, I'm Warren Pearson, Vice President at Insurance by Dentist and author of Insurance for Dentists Malpractice Edition. On this channel, we bring weekly content designed to strengthen your practice, improve your risk posture, and give you clarity on how to protect your career. If that sounds valuable to you, be sure to hit that subscribe button and hit like on the video. Now let's talk about why communication is one of your most powerful risk control tools. Communication might feel like a soft interpersonal skill, but in reality, it's a structural safeguard. Most patient frustrations don't start because of poorly performed dentistry. They start because expectations and understanding were misaligned. Trust is established through clarity and empathy, and trust is the single strongest buffer against complaints or litigation. The first component of strong communication is clarity. Messages must be explicit, instructions must be specific, and patients should never be left guessing about what will happen or what to expect. The second is conciseness. When communication is short and focused, it is absorbed and retained much more effectively. The third is concreteness. Specific sensory descriptions, specific steps, and specific instructions prevent ambiguity. The fourth is confirmation. Communication doesn't end when you finish speaking. It ends when the other person demonstrates understanding. And finally, compassion plays a vital role. Tone, pacing, attentiveness, and warmth matter. Patients feel safer and more respected when communication is delivered with humanity. It also matters how information is delivered. Some communication requires real-time human interaction, especially when the conversation carries emotional weight or immediate clinical importance. Other information can be delivered asynchronously, such as scheduling or routine follow-ups. And anything involving patient information must be communicated through secure, appropriate channels. Choosing the right mode of communication is a big part of risk management. Closed-loop communication is another layer of safety. When instructions or numbers are repeated back, misunderstandings decrease dramatically. Structured communication methods, such as providing background, context, and reasoning in a consistent format, make it easier for colleagues and staff to understand precisely what is happening and why. When dental teams have a language that allows them to speak up if something feels wrong, mistakes are caught before they occur. Interruptions are another hidden risk. Dentistry requires intense focus and precision. During certain phases of treatment, even minor disruptions increase the likelihood of slips, oversights, or memory errors. Establishing designated no interruption moments during critical steps make those moments safer. When the entire team understands and respects those focus periods, risk is dramatically reduced. Communication with patients is equally important. Many patients cannot interpret clinical terminology. They don't understand procedural names the way clinicians do. They understand plain descriptions, relatable examples, and practical guidance. They also need expectations set ahead of time. If soreness is normal, they need to hear that. If follow-up might be required, they need to hear that as well. And one of the best tools is asking the patient to explain instructions back in their own words, ensuring true comprehension rather than passive agreement. Now, finally, communication determines how complaints unfold. When a patient brings up a issue, acknowledgement is the first and most effective step. Listening without defensiveness allows you to understand the root of their emotional state. Clarifying the issue, offering explanation, implementing corrective steps when needed, and following up afterward transforms the experience from adversarial to collaborative. Many situations that could escalate instead resolve quietly when handled with respect and care. The key takeaway is that communication is not peripheral to dental practice. It is foundational. When communication is clear, precise, empathetic, and confirmed, risk shrinks, trust grows, and patient relationships deepen. Every interaction either strengthens or weakens that trust. Treat communication like a clinical tool, apply it intentionally, and it will protect your practice as effectively as any piece of equipment or procedural protocol. That's going to wrap it up. Thanks for watching. I'm Warren Pearson with Insurance by Dentist, and I'll see you in the next video.